Well, what's interesting is we became aware of this. One of our counselors in Muskogee was shown this card by someone at an event there in Muskogee. And we don't know how far it is spread in Oklahoma, but I can tell you I contacted my counterparts in other states. And so far, I've become aware of two other states that have also seen this card. So it's not just here in Oklahoma, it could be nationwide. And unfortunately, this isn't something that's just come out this year. This is something that we tend to see on an annual basis. So, what we tell people to be aware of is oftentimes these postcards or letters will look very official. In this case, it's red, white, and blue. It looks like it's coming from the government, and it's very directive. It tells them we are informing you that you have an appointment to get signed up for Medicare. And in this particular case, this card was being sent to individuals who are turning 65. So these are people who are anticipating getting ready to enroll in Medicare. So in their minds, most people really aren't that familiar with how a person gets enrolled in Medicare. So in their minds, they're thinking, oh, I guess everybody gets this phone call. So they're thinking, oh, this is the process. And nothing on this card tells them anything other than this is the way of the world. This is the way things are done. And so consequently, there's nothing that tells anyone anything different. Now, a lot of times these cards will have something on there that might even make it look more official. They may have an emblem that resembles an eagle or something like that. There's no end to the links that people will go to make these documents look like they're coming from a very official governmental source to get people to respond to these cards. In some situations, these cards are trying to get people to respond to an insurance ad. In other situations, they're just out and out fraud. And if they can get people to call them, then they can collect all sorts of personally identifiable information that can be used for the purpose of enrolling them in a product they may not want. It could be used to steal their identities. So there's a number of reasons why responding to things like this can be very dangerous. In this particular situation, we've done some research and we found that in this case, if you contact the phone number, in some situations, the phone went dead. In other circumstances, we actually got a recording that identified that the entity represented 22 to 24 different insurance carriers. In other words, this is somebody that was generating business to sell people insurance products. And if that's the case, the only thing that would have made this card legitimate is they should have put a disclaimer on the card that says, we are representing an insurance company. We are licensed insurance agents. If they'd have put something like that on this card would have been perfectly legitimate, but they didn't do that. And they did that specifically because they didn't want to. They wanted people to think this was something that was being sent from a government agency to get them enrolled in a government program. Our program, the Medicare Assistance Program at the Oklahoma Insurance Department, we are located at the Oklahoma Insurance Department. We're actually funded by federal grants through the Administration for Community Living. And part of our role is to take reports about specific things like this that could be potentially fraud so that we can report those through the Administration for Community Living to other federal agencies such as the Office of the Inspector General, the FBI, and other entities so that they can investigate these further and hopefully identify and address those problems on a systemic level and get them under control. This time of year, we see this kind of fraud come up on an annual basis. It's just that time of year. October 15th through December 7th is the open enrollment period when we want seniors to be paying attention to what their options are for insurance. And so we typically will see things like this that will come up, offers for free services or ads for different products and things like that. So it's a really good time for seniors to be paying attention to what their healthcare coverage is, but also to be extra vigilant and making sure that any phone numbers that they call, any ads that they respond to are from legitimate resources. they can always give us a call. Our program, we're there to help people understand what their insurance options are. We're not with any insurance company. We're with we're a federally funded program. So we're just there to help them answer questions. Anytime anybody may have given out their Medicare number to someone that they shouldn't have, and they know that they've done this, they need to report that information to the folks at Medicare. They can call 1-800-Medicare and make them aware of it. They can also give us a call at our phone number, 1-800-763-2828, and we can help them with that process as well. And Medicare nowadays, in the old days, you couldn't get a new Medicare number. Now you can. If Medicare identifies that you actually have been a victim of fraud, they can issue you a whole new Medicare number. They can issue you a new Medicare card, and that stops the fraud from recurring. In this day and age, with the electronics, with the internet, with AI, and all of these other things, it's virtually impossible to know what's what. What we tell people is before you actually respond and call a phone number or click on something, perhaps don't respond to that particular ad or that website. Get out of it. Find the phone number for whatever agency it is you're trying to call. If you're trying to get a hold of CMS or Social Security or something like that, find the actual phone number, look it up yourself, and then give that agency or that insurance company a phone call using that phone number rather than the link that's on that website, just so you can be sure that you're actually speaking to those people. And the same thing is true if you get a call from somebody who claims to be, maybe they're calling from a hospital that claims you owe them money or something of that nature. Don't necessarily give that information to that person. Hang up, call a phone number that you know goes to that facility or that agency, and speak to those people there. For one thing, if they are communicating with Medicare, the Medicare website is going to be medicare.gov. It's not going to be medicare.com or medicare.org. So that's one of the things that you can do. You've always got to be very, very conscientious about how the website itself is spelled as well, because sometimes they'll switch a couple of the letters or something like that, and it looks very official. I always tell people it's always better for you to do the reaching out to somebody as opposed to just responding to something that is coming to you. You really have no way of verifying if somebody is contacting you that that's who those people are. It's just better to verify than to assume that that person that's contacting you is who they claim to be. Here's the main thing to think of in terms of Social Security, Medicare, agencies like that. They're not going to call you. Medicare is not going to call you. If they need to communicate with you, they're going to send you a letter. Social Security is going to send you a letter. So if you're starting to get other communications from entities claiming they're from Social Security or Medicare, claiming that you owe money or that you've done something wrong like that, then you can pretty much bet that that's not who you're talking to, and you should discontinue that communication. By and large, we tell most seniors, if your phone is ringing and you don't recognize that phone number, don't answer it. In fact, you shouldn't even stop the ringing. That little button on the side of your phone that stops the phone from ringing, that tells somebody there's somebody there. So just put it on silent, let it vibrate, and let it go away. So that's the best way to deal with those types of things. Anytime we get any kind of a call like this, anytime that there is other types of fraud, for example, yesterday alone, we had 8 phone calls that came in regarding people who had received their Medicare summary notice in the mail, and each one of these people had the exact same report that there were charges on their Medicare summary notice for medical devices that they didn't even use in one day. And so once again, we will take that information, we will report that through the proper channels so that these federal entities can start investigating that, and they become part of much larger investigations. So oftentimes the individuals who are impacted may never hear back about their specific case because they do become large part of these much larger investigations. What's important though is that they minimize the impact to themselves. They need to report the fact that, one, they don't use that piece of equipment, so it can be removed from their Medicare summary notice. They need to report the fraud so that they can get issued a new Medicare number to stop any future fraud from taking place. And they need to alert their providers that they've got a new Medicare number so that it doesn't impact any future billing for future Medicare services that they receive from those providers. In the situation with this particular postcard, if somebody were to call this phone number and the person on the other end enrolls them in an insurance product, there's the potential that the enrollment of them into another insurance product could cancel this person's current insurance that they actually wanted to keep. That could be devastating because it could impact an ongoing treatment plan that those people currently have. That's one potential outcome. The second is, what if this postcard wasn't tied to an insurance broker or agent? What if this person was just simply gathering personally identifiable information, including their social security number? That's the golden key to just about everything that you and I have. They can steal your identity. They can do all sorts of things. They can open credit card lines, make purchases. They can do all sorts of damage with that information. So it's sort of an open-ended, trail of not knowing what damage they could do unless you're someone that is very, very vigilant about watching your credit reports and stuff. The damage could be astronomical before you even know it's been done. We don't want seniors to be afraid. We're not trying to scare them. We just want to remind them that now is the time of year when they are going to be bombarded with advertisements, messages, emails, and it's just a very important time for them to be very, very aware that there's going to be a lot of information flying around out there. And it's always a really good idea to find a resource that you trust, that you can go to, that can assist you with that information. In some situations, it's an insurance agent that you've been working with, that you know that you can trust, that you can go to for answers. In other situations, it can be a program like ours, or you can just contact Medicare directly at 1-800-MEDICARE. Don't feel like you're alone, that you've got to, steer your way through all of this stuff. Always, communicate with someone. And if you do get a phone call from somebody that you think might be something that is wrong, that sounds shady, hang up the phone. If you do give out information that you think, whoops, I shouldn't have done that, call and report it. Don't be embarrassed. We've all done it. It doesn't matter how old you are. A lot of times seniors have a tendency to think that the fraudsters are going after them because we've gotten older and we're not as sharp as we used to be. No, they're going after the seniors because they have deeper pockets. So don't ever feel like you've got anything to be ashamed of or anything like that. Reach out for help.